he always speak the negative, and he will get automatic thoughts are always negative. Okay, so and the person is having very good self-esteem. He will think. We already discussed. Few people they will focus on the problem front. Few people focus on the solution end. So here it's completely the individual differences. So here the person is having individual will have negative automatic thoughts about their own body. If the person is having a low self-esteem, if the person is having high self-esteem, he will think always positive. So all these concepts we have to see and then we need to go ahead. Now social relationship. Why social relationship play a role here? Whenever we are discussing about the social relationship, family is the first social experience, and after that, individual experience will come. Nowadays, if the family is there also, people will say, because parents are staying in some different place and few people they are leaving the country and they are settling the things in different country, and because of the relationship, the distance, and yeah, sometimes they are not available. So here people will say who are very close to them, it's not by the blood, it's not by the bond. So that's the reason people will call who are very close to them, they will treat them as a family. Okay, here whenever the social relationships are too good, the way they are nurturing and caring, and the way they behave with the other people and social support and thought pattern, and they don't feel hopelessness or fatigue or despair whenever people are maintaining the good social relationships. And even the studies also indicates the social support info, it affects on the well-being, physical well-being and mental well-being of a person. See, suppose if the person is very active, he started going walking along with his neighborhood. Okay, he will say hi, hello, and go. Okay, some one day if he is absent, somebody will come and knock the door. Hey, why you are not here? I thought of seeing you. Why you are not absent? So here, because of his behavior and his going into the people and maintaining the social relationship, so individual people will focus and ask, and here he is playing a identity in his social relations, even in his environment. So we can avoid the distortions from the negative distortion from the person. Okay, whenever the person is facing the hurdles, he will get good support from the. So the person who is having the good relationship, social relationships, we can ensure that recovery is very soon. Now we discuss about the work conditions. If the work condition does not promote good well-being, yes, it again causes a stress. Boss is always selling at others and he have an narcissistic personality. So here what happens? The complaint box will be ready. It's always filled with full of loads of complaints. So here this lack of and not only that, even work conditions. Nowadays, few companies they don't provide the health facilities or insurance, and they don't give any leaves. Also, you need to work hard. Working hours is very high because layoffs are going. So people will say because of this work conditions also, it affects their relationship, social relationships, and yeah. Now, personality. See, when we are talking about the social relationship, work conditions and personality plays a role. In personality, suppose if the person have type A and type B personalities, we already discussed in the previous class. Okay, here the type A, they have been actually when we are discussing the type B personalities were those who are much more relaxed and satisfied with the life. Okay, and they have a lot of patience, and yeah, even if they are tempered also they can understand how to take care of that. But here type A people, the risk of falling ill is more, the more risk factors. Falling sick is more with type A personalities. Why means here they can't understand. Even the cardiologist also classified people into types and focus the certain behaviors traits which indicates more or greater risk falling sick. So here, when compared to type A, type B personalities are less prone to risk and less prone to illness. Okay. So when we are talking about the social relationships, we need to speak upon birth conditions and the personalities also. Next, we'll discuss about the management of illness. See, when we are discussing about illness, okay, we already seen the what are the things, and now we need to see how to detect. Early detection procedures are always good, like blood pressure, high cholesterol, identification of such symptoms. It helps the person to get the treatment process early, and he will take care of himself. So, here, management of illness. First thing, whenever they have such doubts on their health, okay, they need to screen for disease. So, here, screening is very important. Mr. Murray, 1999, he also said when the people are addressed or identified the cardiovascular disease, so here, the death rate are very less. Even the cervical cancer or prostate cancer, all these things also, if the screening happened earlier stages, okay, so that we can help the person very easily. Means we can take care of the person in advance. So here, the reduction of illness promoting behaviors at the same time, suppose like addiction, okay, HIV/AIDS, or infectious diseases, or anything, or even sexually transmitted diseases. Okay, all these things. Actually, here we can by screening the disease, we can understand. We can educate the person. We can do counseling. So here, the health of people will come into the picture, and even the unhealthy diet also. See, we people, irrespective of the age and their mm, health issues, they will eat non-stop. Whenever they're in stress, they will say, I'm in stress, I want to eat. Whenever they're seeing food, no, 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 I have craving, I want to eat. So here, because of this unhealthy diet also, they will tend to get more high risk. So here, we can ex- explain the people about the therapies, how to motivate it, to get rid of that and to help more. And we can follow the interventions and we can improve the quality of life. Okay, even wellness programs. See, suppose one person is addicted to more alcohol. Yeah, we can do the motivation enhancement therapy. Suppose someone is suffering with depression or anxiety or stress, we can help people with the cognitive behavior therapy. See, this kind of therapies are there, but most of the therapies are taken care by the clinical psychologist. Okay. So health professionals, they can educate the person. So the remaining part will be taken care by the clinical people. So here, whatever the effective medical care and wellness, here the people will educate them towards this. So we can create a regular and healthy society, and even the psychosocial interventions, like whatever the misconstrued belief system is there. Okay, here we need to educate the people and what are the things they are lacking. We can explain to them. And the prevention strategies or technique also, it should be designed, and we can address the occurrence of any disease. We can help and we can reduce the psychological and physical problems by educating the people. These are all the things we can deal. And we need to explain about the people. Strict to diet, like, see, few people, they're very strict with their diet. If you're asking you to eat after 8, they don't eat. They'll say, I'm done. Okay? They're strict with their diet. And few people, if it is raining, if it's something happening to them also, they don't stop. If it is raining, they will go with the umbrella. Even gym also, they will go like that only. Okay. So here, few people, they will do regular exercise, will dedicate them towards that. Even the medical interventions. See, for every problem, we have a solution because medically we are emerging day by day. There's a reason lifespan is increased. Okay, here we need to educate them towards the medical intervention, and we need to place them what are the treatment for the disease. So all these things we need to understand, and we need to help the person as a health professional. And lifestyle regulation, we need to take precaution on that. We need to explain the person. See, suppose someone is at 21, they can have dinner at 11. But if the same person, if he's having, if he wants to continue the uh, having dinner at 11, it affects his lifestyle. And if this lifestyle regulation, like irregulation because of the age, he needs to change. Otherwise, we need to evaluate his individual lifestyle, and we need to create and need to reinforce the healthful lifestyles. We need to explain. And susceptibility to disease should always be checked. See, few people, they will have sickness. Hey, in Corona, we can see few people, if they are unable to take smells, okay, unable to feel the smell, they feel like, oh, I got Corona. Taste buds. If they are able to taste the food, explain the taste bud. Again, they felt. So here, whatever the susceptibility they have towards their disease, we need to explain them. We need to prevent the individual from falling sick. So here, the health professional, he needs to explain about the disease and whatever the susceptibility they have, we need to eliminate their suspicious nature. Otherwise, what will happen? They will be under stress. I think I got cold. It may lead to some other disease. Doctor said I have cholesterol. It may lead to heart attack. See, before heart attack coming, he will get the heart attack, imaginary heart attack. So it affects her. And not only that, the person will be in constant stress. When the person is in constant stress, he can't able to participate in his day-to-day schedule. We already discussed it. So here, being the health professional, we need to explain about the what are the mental health policies should be inclusive of people belonging to all spheres of life. See, nowadays government is also giving lot of support. We need to educate them towards the support system. And yeah, some ration cards are available in the market. So we need to educate them what are the things are available and how they will get. Few NGOs, they do operate free of cost for the people. So here, being a health professional, we need to know everything. We need to explain them. And here, we need to help the educate them towards exercise, diet, meditation, and other interventions. Then only we can keep the health. So this is what about this. Now we are going to discuss about the next chapter. It's about chronic illness and its impact. What is chronic illness? Okay, we will see now. And what are the psychosocial interventions we can do with the chronic health conditions? One is these are very important. Suppose if you are unable to enumerate the immediate reactions people, how to diagnose of chronic illness, what will happen here? See, they can't they can't understand the importance and the severity of the sickness. Then only if the severity is more, then we call it as a chronic illness. So here we need to explain the coping processes employed by the patients of chronic illness. Suppose if they're treating chronic illness also same the regular illness, then it's going to be a problem for the sufferer, the person. So here we need to explain about now in this chapter, we are going to discuss about the types of chronic illness and what are the symptoms, what are the risk factors, and what are the psychosocial aspects. These are all the things we are going to discuss. And even we are going to discuss about the psychosocial interventions for person with chronic illness. See, actually, when the person is suffering with chronic illness, first thing, it affects on the caregiver. Okay, caregiver needs to have an understand, and even the health professional, he needs to educate the patient at the same time the caregiver. See, whenever we are seeing the chronic cases, caregiver importance is more. Otherwise, what will happen? It affects the person's. See, when the person is in great suffering, he can't explain what he is going through. So here, caregiver role is very important. So here we need to explain the person why this is important Even sometimes if the caregiver is not available and not interested, not so we need to explain the same person what about his chronic illness and what's the terminal illness in this issue, like what are the coping skills he can require or he can acquire, okay, and what are the reactions. It depends on many factors like coping skills, personality, and what are the consequences of the illness, how it's impacting his daily functioning. These are all the things we need to explain to the person when the person is suffering with chronic illness. And here we need to improve the coping mechanism, how to take care of his illness, and how he can uh, seek help from other people, and what are the different psychosocial interventions that can be employed to help the people are to cope up effectively. So these are the things we are going to discuss. Now we'll discuss about chronic illness. Okay, here the Centers for Disease Control and Prevention, CDC, okay, is defined. They may ask you the question. Chronic illness means illness that are prolonged, do not resolve spontaneously, and are rarely cured completely. So here, suppose one person got an headache. Suppose he applied some balm, or if he took some medicine, it will it will be cured. Suppose same person is suffering with brain injury because the accident. So here we cannot resolve this issue spontaneously and rarely cured. Why means we can't say when the person met in a brain accidents. Okay, we don't know. So all these things we can't resolve the things. So it may cure, it may not. So this is called chronic illness. Actually, when we are calling it as a chronic illness, it is called something is easily not cured. That we need to understand. And it's a long lasting. Sometimes it, most of the times it's usually permanent. Then only we'll call it as a chronic, acute chronic. Okay. So here, because of this, the part of person's life may change. Even the job and other family members may get affected. Sometimes, yes, we need to re-evaluate the person. And yeah, like potentialities like driving factors in their lives, everything will get disturbed due to the chronic illness. So here, we don't need to worry only about when the person is suffering with a chronic illness, not only about his physical, and we need to take care of the health, well-being. At the same time, we need to look into the emotional and financial loss of the person. Sometimes relationship loss will be there. Suppose every day he's going to office because of this chronic illness, he's unable to join with the publics. Then what happened? It affects his life. Okay, so here, when the person's in suffering with chronic illness, we need to make them to understand and this chronic illness effect at the same time how to take care of this and who all are supporting for this illness and what are the common chronic illness is there, like for coronary heart diseases, diabetes, asthma, stroke, arthritis, and Crohn's disease. Okay, Crohn's disease means it affects the what we call digestion. So, okay, digestive tract. So here, whenever people are suffering, we need to understand all these things, then only we can guide them. Being a health professional, hey, this is just chronic illness, so don't worry. If you're not taking treatment also, it will be fine. Just maintain lifestyle changes. No, it's not like that. Whenever you heard about the chronic, okay, depression or anything, even the psychological dysfunction also, yes. When the person is saying chronic, we need to place the thing in first place. And now we discuss about the initial reactions on having chronic condition. Mr. Franklin Schonch, he described a set of stages of sequences, reactions through which people may seem to pass following the diagnosis of chronic illness. Actually, he observed many people like the patients on rehabilitation and health settings, Mr. Fons. So he developed these are the sequence instructions. See, when the person is heard about his chronic illness, what will happen? He will get shocked. Why? By hearing the diagnosis. Oh, why me? How me? I'm a very good person. Why it's hitting me? And slowly, only he will focus upon the symptoms. First, these things will come into pop up into mind. Shock. Oh, it's an emergency response. Few people they will cry, weep, yell, and yeah, the big behavior of automatic old fashion or new fashion they do, and yeah, sometimes they act like detached completely from the situation. They don't know anything. It's okay, quite normal. What is there? So because they'll act because of the shock they do, and how the encounter reaction following the shock the patient may undergo an encounter reaction. How he encounter? Actually, whatever the feeling is, negative feeling, or discomfort, or distress. Okay, sometimes yes, why me? Why only me? God is not fair. People will get angry. Angracious may rise. And all these things we need to see. And here, whenever the person is disorganized, thinking and feeling of loss, grief, helplessness, despair, and being overwhelmed by reality. All those things, whenever the person is encountering the reaction, he will face it. Now we'll discuss about the retreat. This is third phase. So here, in this, we need to know how to retreat the person. See, initially what will happen, essentially, we need to prepare for the denial mode. Okay. So here, where the patient acts if the disease or illness is simply not present, it's not happening to them. See, most of the mental health issues, yes, we can see them. They will say, no, 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 I don't have this issue, paranoid, schizophrenia patients, they'll say no. And they don't want treatment, even with personality disorder people. If they don't accept whether the disease have, few people, they'll say, hey, it's simply some heart problem. Okay, these people wants money, no? So they're going like that. Today also, yeah, I seen one person, he has saline in the hand and all. When I asked him what happened to you, he said, I got some stomach upset, stomach issues. I went to the hospital. They put me on saline. So I was there for in the hospital for 2 days. How are you feeling? When I asked, he said, "No, I'm good. And all." But see here, he said, I don't know the reason, but whoever all are coming to a hospital, they're putting me into the salaries. Okay. So here what's happening? He's completely denying I am good, but these hospital people they did this. So this is called denial mode, retreat, adaptation. Actually, when the person is seeing the symptoms, okay, it may remain the same or get worse also. Or else, yeah, recover maybe. Okay, but here, base of the operation. Okay, here the person needs to understand and he needs to get ready with the health problem and whatever the implications he needs to be adjusted. And in this stage, he needs to understand what are the coping skills and how he is going to react and what are the classifiable like isolation or else taking rest or yeah talking to somebody or going for the treatment, all these things. Mr. Kilbury Rosas, 1969, he explained about the diagnosis of terminal illness, the way people will behave towards the terminal issues, terminal illness, even the responses also. He studied on. So here, people are completely unique. So they will go with the different adjustment and different adaptation skills towards their illness. We need to see. And the coping process in patients of chronic illness, how the patients cope. Few people, they may go with the cognitive appraisal of the meaning, or few people, they go with the, oh, I have a lot of issues. Again, on top of this, one more. So they will count it. And the outcome is like individual, what, how the way they formulate and the way adaptive techniques are different. Okay, now we are going to discuss about the, according to Moose 1982, how he developed two types of adaptive takes in the coping process. First one is tasks related to the illness of treatment. See here, what will happen in the task related coping with the symptoms of disability and health problems. So here, how the person is coping towards his symptoms and what are the disability issues he is focusing on. So these are the things we need to understand, we need to educate, and we need to know that information before in hand before the client. And the second point is adjust to the hospital environment and medical procedures need to be treated. See, even when the person is seeking an injection, they will cry. And hospital adjustment. Yes, whenever you are in a hospital, the smell is completely different from your home. So here we need to get adjusted. And even we can see a lot of cries and pain and lot of discussion. All these things may happen in the place. So we need to get ready. If someone dies, they will cry bigger and louder. Someone will say, no, no, how are you? And all. So all the atmosphere, we may hear a lot of death cases. Or we can see a lot of blood. Okay, even if the person is, so here he needs to get ready whenever the person is ready to go for the treatment. The next one, develop and maintain good relationship with their practitioners. This the person has supposed to do. Suppose if the person is unable to do, what will happen? Task related issues will be more. They can't understand what's happening in their life. And now tasks related to general psychosocial functioning. First one is here, controlling negative feelings and retain positive outlook for the future. See, if the person is having a pessimistic nature, what he can see, can he see the bright future? No. He can't see the bright future. He will see only the rough future, like negative. So here we need to, the person needs to maintain the satisfactory self-image and sense of competence. See, if the person is suffering with low self-esteem, how can he take care of himself? How can he help himself? So here, first the person needs to adjust and he needs to treat the problem. We already discussed that always we need to focus on the solution end, not the problem end. And here, the next one, develop and maintain good relationship with their practitioners. This is very important. Suppose if the person is not maintaining the good relationship, how can he share his personal issues? So here, this is not only the patient job, even the health professional job also. And the task related to general psychosocial functioning, okay, control negative feelings and retain positive outlook for the future. And it needs to maintain the self-image and sense of confidence and preserve good relationship with family and friends. And even we have to prepare for an uncertain future. This is very important. Suppose, yeah, because of the chronic illness, he may lost his job, his financial will be very going may down, or else because of that he may lost his friends. So people are not interested, not willing to talk to him. So he needs to prepare in advance. What is there with me, it's going to be there. So here we need to understand what is the risk factor, and how it's difficult. Actually, suppose if you're seeing from the client base, like patient base, yeah, the situation will be different. And a few people, they have, because of the disability, for disfigurement or death, okay, here they will show the poor prognosis and health managed to adapt successfully. All these things will happen. See here, even the crisis theory also proposes patients encounter these adaptive tasks in any health problem as per their experience. Why means they will have some information. Few information come from the social media, few may come from the friends, or few may come, they may imagine also. So all these things will happen. So here the health problem we need to understand, The person needs to feel his own experience, and he needs to focus on the, even the health professional needs to focus on the personality and environmental and the circumstances of the person. So we need to look into all those things. Suppose suppose women have a mastectomy. Okay, we need to focus on the adapting to her new self-image. So a person needs to work hard when the person got operated in a mastectomy. So here biological changes at the same time emotional, and he needs to face the people, social challenges. So these are all challenges will be there because of the small issue and yeah. So all these things we need to see. Next, we'll see the coping process in patients of chronic illness. How the coping will do. First thing, Morse, 1982. He explained few two types. One is the task related to the treatment. Here, task means completely focus on the disability of the health issues. And yeah, they need to get adjusted and develop the maintaining good relationship with other practitioners. And whenever we are focusing on this, we need to see what is our end term. We need to achieve a goal. What is our goal? To help the patients in a prominent manner, to help them to recover very fast. So here we need to see what are the things and what are the needy things we can do. And different chronic illness. What are the chronic illness we'll see? First, it's CHD. CHD means coronary heart disease. Here, what will happen? There is an issue with the vessels which supplies the blood towards the heart. Okay, actually, here what happens in coronary heart diseases? The vessels become narrowed or closed. Okay, and here the flow of oxygen and nourishment to the heart is particularly are completely obstructed. Actually, in this, okay, for them, falling the pectors are like it may cause the chest pain and it may go with the arm. So all these things, a few people they may go with the severe depression or heart attack. Okay, all these things will be happen whenever we are discussing about the coronary disease. And here, what are the symptoms? First thing, uncomfortable pressure. People will say, I'm feeling, even not only coronary, people will say who are all suffering with anxiety, they'll say, I have a heart pain. So we need to discriminate like what is a heart pain, what is anxiety pain. And squeezing, fullness, okay, and pain in the center of the chest. And it lasts for more than a few minutes. Then we need to consider it as a CHD, coronary heart disease. And here, what are the risk factors? First one, okay, actually here, when the person is getting the risk CHD, coronary heart attack, first it spreads shoulders, then neck, and then arms. Clear? The suppose someone is saying like this, we need to take care of the medical emergency. We need to understand his position. Oh, he needs some medical facility immediately. And the chest discomfort with high headedness. That's also one of the thing. And fainting, sweating, nausea, or shortness of breath. All these things symptoms of the CHD. Next, what are the risk factors for CHD? We'll see. We'll see the risk factors. What are the risk factors here? First, the biological factors and lifestyle. What are the biological factors? First, the person is suffering with the levels of inflammation or high blood pressure or high cholesterol. First, the behavioral changes will happen. First, he needs to quit the cigarette smoking and he needs to do the exercise. Otherwise, what will happen? It affects his obesity. Okay, it may lead to obesity. And suppose lifestyle factors, if he's not changing, like sedentary, like getting little exercise, being obese. Okay, all these things, the biological factors of the lifestyle for the CHD. Okay, all these things, if he's not taking and he's not eating the vegetables or fruits, okay, or he eating like a triglyceride side or not having any kind of taking more cholesterol foods like sweets, ice creams, junk food, then it's a first whenever the person is suffering CHD, he needs to take a look into his biological factors. And next, stress. We already discussed about stress. Stress, whenever the person is having the CHD, first thing, emotional pressure will be there, anger will be increased, and extreme excitement. So he needs to avoid all these things, negative emotions. If the person is seeing himself, he's getting into the negative side, okay, he needs to take care of himself. Otherwise, what will happen? Like it may lead to heart attack, angina, or death. Or else sometimes if he's taking more stress, okay, then that also leads to that. And socioeconomic status and family environment. Okay, here the risk factors for heart disease are more common in individuals with low SCC, low status. I mean, why means here the people may go with the harsh or sometimes maybe cold. Okay, so all these things. People they may say neglectful and family environment in childhood increases the risk on its own. Okay, the stress and difficulty developing the social support, all these things may lead, all the circumstances. So actually here, these are all the factors to improve the cardiovascular risk. This study was done by Mr. Matthews and Gallo in 2006. And depression and CHD, yes, it plays a hand-in-hand role. Okay, here we need to see depression affects the development progression and mortality from CHD. So here, if the person is suffering with the depression, okay, a risk will be more. See, we need to understand what are the symptoms for the depression, and we need to suppose if the person is going with the smoke and all, we need to avoid. And vital exhaustion. Investigators have related vital exhaustion, mental state characterized by the extreme fatigue, feeling of being dejected or defeated or enhanced irritability. All these things may lead to the cardiovascular. Okay. And the next one, vital exhaustion. What are the vital exhaustion? Investigators have related vital exhaustion, a mental state characterized by extreme fatigue, feeling of being dejected or defeated, and enhanced irritability. Okay, towards this. Next, what is the psychosocial impact of coronary heart disease? First thing, whenever we are discussing about this, the person is unable to, suppose if he is driving the car, are doing the household things, are lifting heavy things, he needs to be careful. Wearing the overexertion could bring to the new attack. Driving the car also, suddenly someone is coming, his heart may pump more. So yes, those are the things he needs to avoid. And the family needs to get adjust to their conditions. And the person is being, who are all suffering with the chronic health problems, and he needs to work upon the, like, who has suffered heart attacks. That's the reason, even if you're joining in a job, also they will ask you your condition. If you're going for any particular disease or particular help, also, okay, above the age people 50, they'll ask, okay, what are you dealing and how is this, how it's working. So here the social psychosocial impact is also very high. So here we need to see what kind of effort he's putting and what kind of stress he's taking in the job over the 50 years. So we need to express and he needs to take care. Even he needs to explain to other people also. See, I have this attack. So if anything goes wrong, please try to help me out. This is my situation. So even the cardiac illness and family relationships are also interrelated. Even studies also found that cardiac patients with strong social support recover faster than survival the person who is all alone. So here we need to see the heart patients of the family. If the person is arguing towards the financial crisis or like a poor health issues or poor relationship, or relations, it may get worse also. So here, the person needs to understand. Few people, they'll always blame, because of your habits only you developed this. So they don't help the person, the patient. If the person is not getting help from the other people, yes, their chances are very high to get the second actor. So here families needs to help the person, and they needs to maintain a good relationship to avoid this. Stroke is actually, even you can see in the corona time, people got more stroke because the other person got the attack. That's the reason he got. So stroke results from a disturbance in blood flow to the brain. Some strokes occur, the blood flow to localized areas of the brain is interrupted. Okay. So here we need to see the blood leaks into the brain, bleeding, sometimes cerebral hemorrhage. Okay. Even if it is an accident, sometimes people may get blood clots in the brain, and circulating blood clots, that is called emboli, and block of the blood flow. Okay. All these things will be there. And yeah, even the blood leaks into the brain also. It may lead into the large areas to the nervous system. So all these things we need to consider. And if the person is unable to um, explain, see, few people, they can't explain the stroke also. They have a confusion. Okay. So here, trouble to explaining, trouble to speaking, it may also lead. Uh, Actually, sometimes they can't see the both eyes. That's also one thing. And sudden trouble walking, okay, dizziness, loss of balance, or coordination, or a sudden severe headache with no cause. All these things may lead to stroke. So here the person needs to have this kind of information before in hand. Then only they can understand the stroke. Risk factors for stroke. What are the risk factors? First thing, stroke increases with age and occurs more often in men than compared to women. Okay, and yeah, it may, like diabetes patients also, they may get. Okay, and the negative emotions. Who are the persons, like negative emotions like anger? That's the reason people always say, "Do you have BP? Okay, control your BP, otherwise it may lead to stroke." Okay, these are the risk factors. So here, hypertension. Okay, it may lead, and the anger. Please reduce your anger. Your age is increasing. So here we need to look into that. And depression and anxiety also predictive of stroke. Even psychosocial aspect of stroke. Here, psychosocial aspects, when we are discussing about this, we need to see depression. Also, it may leads to that. So if the person is having depression, we need to understand why and how he is taking care. And if the person is having unfavorable circumstances, it may leads. Okay, impairment of produced by stroke, having a important psychosocial effects on patients and their families. See here, when the person is paralyzed or have aphasia, those patients also we need to see. I mean, they can't adjust with the people, and the relation and roles also will change. Even the marital harmony also, it also affects the social, leads to the stroke. And yeah, leisure activities, how the person is spending time, in what way he's actively he's doing any physical activity, or is he sitting and doing. Hypertension is one of the factor, because of the high blood pressure or cardiovascular disease, it may leads to the CHD. And yeah, vessel exercise, and here the pumping, the cardiac output is too high, which represents the arterial walls as the blood flow increases. So here he needs to maintain that balance always. He needs to check what is my hypertension, okay? And even the cognitive functioning also he needs to see. And problems, like whatever the problems he's learning, suppose if you have inattention or abstract reasoning, see, all these things are reduced. Again, cognitive skills are reduced also, we need to see. And what are the risk factors for hypertension? Okay, first thing, it may be failure of the kidneys or to regulate the blood pressure. Here, 90% of all hypertension is essential, that is of unknown origin. Okay, here, childhood temperament, emotional excitability. Actually promotes central weight gain in adolescents, which in turn predicts CVD. Okay. And here we need to see gender. We already discussed, when compared to men, women will get more. Okay. Hypertension also. Males greater risk than females. From age 55 to 64, men and women faces the similar changes of developing hypertension. After 65, it's prone with more with men. Genetic factors one of the reason. That's the reason whenever people are getting married, they need to see the family history and psychiatric history of the family also. Okay, emotional factors. Someone has like depression, even childhood anxiety, suppression anxiety with the child, and hostility, and all these things it affects that. And anger issues, it plays a vital role, and the cynical, distrust, hostility, and excessive striving in the face of significant odds. This also, and family environment. We already discussed this. Chronic anger also, stress. Stress is the one of the factor. Even the social conflicts. If the person is having a lot of conflicts, even the job strain, we already discussed even as for stress also like, and the combination of high demands with the little control, and not only that, suppose someone is working with the crowdy and noisy environment, yes, it may lead to hypertension. And what are psychosocial aspects in hypertension? Okay, in psychosocial aspects, in the sense, distress first thing will come. We already discussed in the first way. Okay, and even the patients who are got hypertension people, like the person is suffering with the clinical concerns like depression, anxiety, stress, all these things also it affects the persons to get into the diabetics. And diabetes. So diabetes is also, actually, if you see, diabetes is prevalent illness around the world. Nowadays, you can see a lot of studies on diabetes. Middle-aged people, they tend to get more diabetic. Nowadays, people and children and adolescents also, they're getting. Here, we need to see the glucose to fuel metabolic process. Okay, if it is very high, if it is a long term and long period of time. So here, the hyperglycemia, how it's conditioned. Okay, so here we need to see that hypoglycemia, and here we need to see the pancreas uh, unable to produce the sufficient insulin. That's the reason people will go with that. So here how the functioning of pancreas we need to see. And yeah, here we have the type 1, type 2 diabetes. Type 1 diabetes sometimes called insulin dependent diabetes also. Okay. Actually, yeah, typically develops in childhood or adolescent stage. Hardly 5 to 10% of the diabetic cases we can see. Okay. And here, sometimes type 2 diabetes called non-insulin dependent diabetes. Okay, here they don't need to use insulin. Yeah, they can go with the injections, or insulin injections not required. They can manage with their glucose levels, or they may take some supplements of the medicine. Okay, type 2 diabetes can develop at any age. It usually appears after the age of 40. And what are the causes of diabetes? See, in type 1, first an environmental condition and involve a viral infection that stimulates the immune system or to attack the pancreas cells. Suppose if anything happens to them, if it attacking the pancreas is not working properly, or it affecting the pancreas cells, or because of the health condition also it may affect sometime. So type 1. Type 2 is completely possible in three conditions. One is the diet, fat and sugars, intake of fat, and here overproduction of protein that impairs the metabolism of sugars and carbohydrates. That is also one of the factor for type 2. And psychosocial factors in diabetic care. Actually, whenever the person is changing the lifestyle, here he needs to understand the cure of illness. Whenever people are getting into the diabetics, they will think too much, or nowadays diabetes is common because of the sedentary lifestyles. So here, they need to control the sugars first. They need to control the stress. They have to be in a cool environment, peaceful environment. Okay. So here, they need to carry their injection or insulin, whatever the goals for the physician they are saying. And they need to see their day-to-day activity. Surprisingly, these patients, what they will see, they need to work upon their actual glucose levels to match their mm, physician. Okay, now we are going to discuss about the asthma. Asthma is an inflammatory disease. It makes breathing difficult and can make some physical activities difficult or even impossible also. Okay, in asthma attack, people can also like emotional stress and will be more. And asthma is severe allergic reaction, typically to a foreign substance, including dust, dog or cat, dander, pollen or fungi. Okay, see nowadays, so everyone is carrying the dog. That is also one. Even the birds. Okay, pigeons also one of the reason. And actually here what happens, it affects their bronchial tubes and even affect the tissues of the chemical called histamine. Because of this chemical reaction causes irritation to those tissues. So asthma attack happens, the muscles surrounding air tubes constrict. Inflammation and swelling will be more. And the lining of the air tubes will occur. And actually it increased mucus is produced. Okay, clogging the air tubes will be there. The mucus secretion, in turn, it may obstruct the bronchioles, reducing the supply of oxygen and difficulty to breathe and increasing the amount of carbon dioxide. Okay, these events last perhaps for an hour or two. Then what happens? It damages the tissue. So here, the increasing the likelihood of more frequent and severe future attacks. So what are the causes of asthma? One is asthma attacks usually occur in the presence of certain conditions like called triggers. Okay. First, the personal factors like respiratory infection or feelings of anger or anxiety in the environmental conditions such as air pollution, pollen, cold temper, or physical activities like strenuous exercise. Okay, it may lead to different asthmatics. And here we need to see what are the allergic reactions of the person and physical exercise, cold air, all these things will be there. And sometimes the diet also. Okay, most of the time they may take injections and psychosocial factors. Yes, same thing like anxiety and emotional arousal and stress. Okay, inhaling and exhaling problem because of the placebo effect, all these things will be there. Next, allergy. We'll discuss tomorrow.